Epilepsy is one of the most serious and important neurological disorders. It is actually the seventh bothersome neurological disorders in the world. But the problem with epilepsy is that in most countries of the world, probably 95%, there is no accurate data on frequency, distribution, risk factors of epilepsy. And therefore, public health cannot develop evidence-based strategies to reduce the burden of epilepsy and improve healthcare for people with epilepsy. And the other reason for doing large epidemiological studies of epilepsy is to provide some insight into the geographical distribution, the influence of various populations, socioeconomic factors on the burden and frequency of epilepsy. In brief, we found that almost 1%, to be exact, 0.7% of the global population, or almost 52 million people, are currently suffering from epilepsy, active epilepsy. And we defined active epilepsy as epilepsy that has a seizure, at least one seizure in the last 5 years, regardless of anti-seizure medications. The second, probably most important finding was that our study included in the analysis not only active primary or idiopathic epilepsy, but also secondary epilepsy. Epilepsy that has some underlying cause, known cause, such as abnormalities in the brain or chemical changes in the brain. And it is important from our standpoint because it gives public health information how this secondary epilepsy could be prevented. And not to forget another important finding, that over the last 3 decades, the burden of epilepsy in the world has increased quite significantly by 15%, mostly because of the secondary epilepsy. Probably the causes are difficult to define of that growth, but probably brain birth defect, infections, various degenerative disorders of the brain. We all know they are on the rise, and they may be associated with epilepsy. And last but not least important finding was that bulk of the burden of epilepsy, 80%, lies in low to middle income countries, particularly countries such as sub-Saharan Africa and Central Asia. And we certainly need to improve the situation for people suffering from epilepsy. I would say that the most important thing in low middle income countries in particular, where the bulk of the burden is to improve accessibility to specialized neurological care and medications for epilepsy, because this access costs money, not always available, and this is a great barrier to improve outcome in people with epilepsy. Secondly, it is important to misspell some misconceptions about epilepsy, because it actually prevents better care and better social adaptation of people with epilepsy. And to improve the situation, we do need good quality epidemiological research especially in various countries, low middle income countries in particular, studying risk factors of epilepsy, because still we have no well-established risk factors for epilepsy. For secondary epilepsy, we know causes, but for idiopathic epilepsy, we presume they are genetic causes, but we don't have good genetic research pin out which genetic markers are the most important for epilepsy. So more research is needed.